staying healthy around animals and bugs to reduce the spread of zoonotic diseases. What do West Nile virus, rabies, avian influenza, and Lyme disease all have in common? There are zoonotic diseases that can spread between animals and humans, including between wild animals, poultry, domestic mammals, mosquitoes, ticks, and humans. People who work near and/or with animals, or those who work outdoors, are at greatest risk. This can include occupations like veterinarians, forestry workers, landscapers, farmers, construction workers, wildlife and pest control workers. We'll explain how you can reduce the risk for workers, but first, let's look at how zoonotic diseases spread. Animals and bugs can spread pathogens like viruses, bacteria, and parasites which can cause zoonotic diseases. For example, avian influenza, also known as bird flu, spreads among domestic poultry, wild birds, and some mammals. While human infection is rare, it is possible. There are several ways zoonotic diseases can be spread between animals and human. Physical contact with feathers, fur, feces, urine, blood, and other bodily fluids of an infected animal, including through bites and scratches. Contact with areas where infected animals live, or surfaces or environments contaminated by infected animals. Breathing air or dust particles contaminated by infected animals. Bites from bugs and ticks or mosquitoes that carry and spread pathogens from infected animals. Now we'll talk about ways to reduce the risk of contracting zoonotic diseases. It's the employer's responsibility to identify all hazards to which workers could be exposed, and to implement and support measures to reduce risk together with their employees. Workers are responsible for reporting hazards, using personal protective equipment or PPE, and working in a safe manner as required by the employer. Measures to reduce risk can include vaccination, if available and the worker is eligible, work upwind from animals and specimens if working outdoors, work in well-ventilated indoor environments, regularly clean and disinfect surfaces, objects, and shared equipment, keep animal housing areas well organized and clean, regularly wash your hands with soap and water or use hand sanitizer with at least 60% alcohol. Avoid touching your eyes, nose, or mouth with unwashed hands. Avoid eating, drinking, or smoking while working with or near animals. Wash and change your clothes, footwear, and shower after work. Seek medical care if needed and report bites, cuts, or scratches that occur when working with or near animals. In some situations, PPE can help protect workers against zoonotic diseases, including avian influenza. Appropriate PPE can include impervious, disposable, and cut-resistant gloves, disposable coveralls, eye protection, and a well-constructed, well-fitting respirator or mask. When layered with other protective measures, PPE can help prevent exposure to pathogens in your workplace. Be sure to take extra precautions when handling sick or dead animals. Diseases spread through bug bites. You can also take measures to reduce the risk of mosquito and tick-borne diseases like West Nile virus and Lyme disease. Wear light-colored, long-sleeved shirts and pants tucked into socks, and closed-toe shoes. Remove sources of stagnant water where mosquitoes breed and cut down vegetation where ticks may be present. You can also provide workers with insect repellent containing DEET or icaritin or permethrin-treated clothing, and use mosquito netting and screens where appropriate. Additional tips to avoid tick bites and prevent tick-borne diseases include tying back long hair, doing a thorough tick check on skin, clothes, and gear, and remove ticks as soon as possible. By following tips in this video, you can help prevent the spread of zoonotic diseases at work. To learn more, visit ccohs.ca/zoonotic-diseases.